The statistics are staggering when it comes to Black women and breast cancer. Their chances of dying from the disease are much higher than non-racialized women. A passionate advocate for breast cancer survivors is speaking out about these disparities and the systemic issues in our healthcare system.
We've come a long way, and yes, I acknowledge that, but we still have a lot of work to do, especially in the minority, in the Black community.
Alicia Vienga is the founder of After Breast Cancer, a Toronto charity that supports women on their journey back to health and beyond. She says Canadian breast screening guidelines do not recognize that minority women are at a much higher risk of severe disease and death at a much younger age.
The way it put chills in my body, it should really bring chills to anybody who's reading those stats, who's hearing this.
Research indicates that minority women are underserved in the healthcare system. 72% are more likely to be diagnosed with invasive breast cancer before the age of 50, and 58% are more likely to be diagnosed with advanced stage disease. Minority women are also 127% more likely to die from breast cancer compared to white women.
Why aren't we going into the community? Why aren't we taking these extra steps? I'm working with Humber College students to get a bus on the road to go into the communities and do screening there, because we know screening saves lives.
Right now, the Canadian breast screening guidelines recommend all women between the ages of 50 and 74 get regular mammograms. High-risk screenings begin at the age of 30 and are based on family history and genes. Dr. Aisha Lofters specializes in Black women's health and says they often face barriers in the healthcare system.
Certainly, I hear of Black women who talk specifically about their experiences in the healthcare system, where they feel that they have experienced microaggressions, macroaggressions, have had to advocate much harder than they should have to get proper testing done. And we know that systemic racism is with us. It is part of our society, as with every country. So there's still lots of work to be done.
And Dr. Lofters says here in Canada, there's a lack of research on how cancer impacts minority groups.
So a lot of times when it comes to racial differences, we look at US data. The same could very well be true here, and we need to study it and understand it.
The Canadian Cancer Society also tells me here not enough information is being collected to address gaps in cancer care, and it recommends the federal and provincial governments mandate the collection of data to provide evidence and address inequities to support evolution and accountability. Shauna Hunt, City News.